India's COVID numbers continue to rise. The concern is, when will India's cases peak, plateau and then decline? The latest count is over 2.5 lakh cases of COVID clocked in the last 24 hours, and the numbers only seem to be rising. While several states are going into various kinds of restrictions to hold back the numbers, the biggest way forward still remains vaccination. Now, the United States, for example, is very close to vaccinating 50% of its adult population and is beginning to see the benefits. What are the directions that we can take from that experience? When will India's numbers plateau and then start declining? To speak on all of this and more, I'm joined now by Dr. Ashish Jha, who is the Dean of School of Public Health at Brown University. Dr. Jha, thank you for speaking with us here at ET Now. I want to begin by getting your take on the kind of rapid, aggressive surge we have seen in the second wave of COVID-19. It seems to have taken most of the administration by surprise. Do you think we didn't see this coming?
Yeah, so thank you for having me back. This is a very concerning situation. We have been watching, I've been watching here from the United States, looking at data from India, and really seeing an increase in cases for almost 2 months now. And in the first few weeks, I think it was being largely ignored, even though it was very clear that infection numbers were rising. And it's only been in the last 2-3 weeks that we've seen real concern out of government. And the problem with this pandemic is, if you act too slowly, if you ignore evidence, you're going to get caught behind. And that's where India is right now. Really unfortunate. More infections are happening in India than any other part of the world. Almost 1 out of 4 infections in the whole world happening right now in India. So we've got to turn this around. And turning it around, when will it happen? It will happen when the policies are able to do those things. And we know what the things are that bring things under control. It's about outdoor and indoor mask wearing, making sure everybody's wearing masks when they're outside of their homes. A lot more testing. Test positivity rates have gone way up, 15-20%. That means we're missing a majority of the infections out there. And then, lockdowns, of course, are very, very unfortunate, because that's really the last resort. But in some places like Mumbai, like Maharashtra, more broadly, you probably need to have some version of lockdowns just to stop the break the transmission chain and get the virus under control.
So just specifically on lockdowns as a weapon of choice to push back the COVID-19 attack, do you think India is now at the place where we need a wider lockdown or set of restrictions? It's been made very clear that we will not have the same kind of complete lockdown like we had last year when the COVID-19 first hit, but there is some version of restrictions or the other in a lot of states, at least 15 to 16 states right now. Do you think these need to be made stricter to break the chain?
Yeah, it really has to be done early and has to be done aggressively. And so I think it will vary from place to place. I agree, we don't need a national lockdown. It doesn't really make sense. But given how widespread these outbreaks are, my take on how strict should be driven by evidence and data. If you act and you don't see it starting to turn, then you've got to act more aggressively. And you've got to pair lockdowns with more testing. India is starting to fall behind on testing. It had been doing very well. And then of course, along with that, mask wearing. Those are your 3 main tools from a public health point of view. And then, of course, the way out of this, and all of it, is through more vaccinations. And India is doing a good job on vaccinating people, but it's got to get ramped up a lot more as well. So all of those are necessary. Lockdowns should not be seen in isolation. To me, it's the most costly intervention. You only use it as a last resort, and you want to use it in a very, very targeted way.
Before I come to the question of the vaccination program, what is your sense of mutations being the reason for this pace of a second surge. There is a lot being said about various mutations, some of them emerging from India. Countries around the world are beginning to respond to this and stopping flights in and out of India. Could it be possible now that there is a mutation which is more resistant to the kind of measures we've been taking so far, a more transmissible mutation which is responsible for the very quick spread of COVID-19 the second time round?
Yeah, so what I would say on this is that we don't know for sure, partly because India has not been doing enough genomic sequencing. So the only way to really track what is happening with mutations and how much they're playing a role is to be doing a lot of genetic sequencing. India has lots of capability to do this. It is not like it is not able. It has quite a good biotechnology industry that can do genetic sequencing of viruses, but it hasn't been doing them. It hasn't been doing enough of them. It should probably be sequencing 5 or as much as 10% of all infections. It's sequencing much less than 1%. The problem with not doing it is we don't know then which variant is spreading where. I think the one that has been originating from India could be playing a role. We don't have enough evidence. There's also B117, the one that originally came from the UK. We know that's in many places in India. I am confident that is playing a role because every other country where B117, the UK variant, has shown up, it has taken off and caused a huge spike in cases. So I'm confident that's also contributing here. But we just need a lot more data, and the Indian government has to be doing a lot more genomic surveillance than they're doing right now.
What are your views on our vaccination program? So we are the vaccine manufacturers of the world. We started off on the 16th of January and there was some vaccine hesitancy in the beginning. And then there has been some criticism about the slow pace of vaccinations. Now we're saying from 1st of May, we'll open up vaccines to everyone, with state governments having to procure at least 50% of the vaccines made. But what are the hiccups you see to this plan, considering India still needs some time to ramp up the number of vaccines needed, considering its large population?
Yeah, I mean, on one hand, you can look at India's vaccinations and be very proud that India has been vaccinating a lot of people, more than most other countries in the world. But of course, it has a very large population, and only about 5% of the population of India has gotten vaccinated. So there is a lot of work to do. Vaccinations as a way to end this pandemic, you need to probably get to 50, 60% of the population vaccinated, if not more. So a long way to go. What does India need to do? Basically, you need to ramp up production. You need to also import more vaccines. Look, India alone, it is the vaccine producer of the world. But India should also be in the market buying Pfizer vaccines, getting other Johnson & Johnson and other vaccines. India needs to have an all of the above strategy if it's going to vaccinate hundreds of millions of people as quickly as possible. And, one of the things I've been very concerned about, so Covishield is a very good vaccine, good data. I think it's terrific. Covaxin, we just don't have much data on it yet. And Bharat Biotechnology is saying they can make hundreds of millions of doses. I think that's fantastic. We need to see more data on how safe and effective that vaccine is, and then start really ramping up distribution of that as well. India has a lot of capacity here, but it's in trouble. It needs to be much, much more aggressive on both producing and acquiring more vaccines.
Now, the issue with acquiring vaccines and some of the vaccine candidates that you spoke about is that they are in great demand all over the world. And Dr. Jha, in part, the United States has been accused of vaccine, quote unquote, hoarding, of piling up more vaccine stockpiles that is required, which is leaving less for the rest of the world. And India would face that crunch as well, isn't it?
Yeah, absolutely. I think it's a real problem. And the Trump administration signed a series of contracts that actually made it very difficult to send vaccines made in the United States elsewhere. The Biden administration is working on that. I expect to see a lot more leadership from the Biden team on this. America has has enough vaccines over the next few months to vaccinate its entire population 2 times over. That's completely unnecessary. We do not need that, want that. And so America has to continue manufacturing vaccines, but then get them out to the world. And places like India need them. Brazil needs them. Other countries do as well. So I agree with that concern. I think the United States has got to play a more productive role in this place.
Explain to us, Dr. Jha, what happens now when 50% of the adult population is vaccinated, like in India. I've been seeing your social media messaging, and the conversation now is about dropping the need for masking outdoors, for opening up things a little more. Does that become safe when 50% of the population is vaccinated? I'm asking this in the context of concerns over here that people are getting infected with COVID-19, in some cases even after receiving both jabs.
Yeah, so people can get reinfected or get infected after having been fully vaccinated. The good news is they're very, very rare, those infections. We've seen them in the United States, and they're very rare. The best example of what to do when you get a large portion of your population vaccinated is Israel, which once it got to about 55-60% of the full population vaccinated, they've seen their cases plummet and they've begun to open things up. And what I have said is the US is not there. Our overall population vaccination is about 38-40%, about half of adults, but obviously no kids. My expectation is that over the next month, we are going to be able to get to 50% of the population vaccinated. We're going to see case numbers really drop a lot in the United States. And at that point, you can begin to slow restrictions. It's all about how much infection there is happening in the community. Once infection numbers come down, I think relaxing restrictions makes sense. Obviously, that is not where India is right now. India is really in a very difficult situation, and they need more restrictions in the short run to get the virus under control.
Dr. Jha, looking at what our vaccination program is looking like right now, looking at the numbers of infections, and we don't know if we've reached the plateau stage yet, what is the kind of timeline you see for India when the second wave will start receding? It's also important because people want to know when things can get back to where they were, at least till November, December, a few months ago. So what is the timeline looking like?
Yeah, it's very hard to predict with any certainty. Things are obviously pretty difficult right now, and how quickly infection numbers can be turned around and brought under control is driven both by policy as well as individual behavior. I think some of what has contributed to India's very terrible outbreak right now is the attitude both by government and more broadly by people in November, December, certainly by January, that somehow the pandemic was over, that India had beaten COVID. And I remember thinking, I don't understand how India could have beaten COVID. Nobody has beaten COVID. India and Indians are not naturally immune to COVID. And we're seeing the cost of that. So how quickly? As soon as, I think we need regressive policy, both on restrictions of public health, more testing, really aggressive policies around mask wearing. I think that will make a huge difference in causing the infections to plateau. And then if people are really adherent to that, it will cause cases to come down. Once case numbers are much further down, you can begin to relax some public health restrictions, but until a large majority of people are vaccinated, the pandemic won't be over. And we have to remain cautious and careful. And we are seeing right now the cost of not doing that in terms of what is happening to India. And I think we can all agree, once we get the second wave under control, we do not want a third wave. And so we're going to have a different strategy for making sure that we avoid any further spikes in cases.
Would that strategy include ruling out things like public rallies for elections, like large gatherings for religious purposes, which seem to be, still going on in some parts of the country?
Yeah, I've been very clear for several months now that I think those are very, very risky. Look, outdoor gatherings generally tend to be safer, but when you see those photos of those large election rallies, people are jam-packed, very few people are wearing masks. We know from lots of evidence that when you get that packed, large group of people not wearing masks, that's very dangerous. I think that's fueling it. Of course, those rallies then lead to people getting together indoors afterwards or before. That's fueling it. We're in the middle of a pandemic. We have to avoid those things, including the religious gatherings, which of course are so meaningful for so many people, and I understand that. But in the middle of a pandemic, we can't afford it. There are just going to be too many people who are going to get sick and die. So absolutely, those large gatherings need to be stopped now, and they need to be really curtailed until this pandemic is under full control.
Dr. Jha, one word from you on the concerns around vaccines, and it seems like most of the major vaccine candidates have seen some sense of pause from various nations. AstraZeneca has seen its use paused by various European countries, who then some of them reversed it. Johnson & Johnson rollout has been paused in the United States recently, which leads to people wondering whether these vaccines are a risky proposition. What would you say to that?
Yeah, what I would say is that the reason these pauses have happened is that government regulators are being extremely cautious about any adverse events. Look, we are in the middle of a pandemic. We have never done a global rollout the way we're doing right now, and everybody is hyper concerned about any side effects. And anytime you see anything, we immediately pause to learn more. To me, that's actually the system working, that we're being very, very careful. What I say to people is you have to contrast that. To other things that people take, other vaccines, other therapies. These vaccines are generally much safer than what people are used to. And it's really important for people to understand that. And then, of course, the side effects of the vaccines are nothing compared to what happens if you get COVID in terms of your risk of blood clots and other complications. So you have to keep this in perspective. Safer than a lot of other drugs and vaccines that people are used to, much, much safer than getting COVID. And that's why I've been very enthusiastic. That's why I've gotten vaccinated. My family's gotten vaccinated. And I have encouraged my family in India to get Covishield as soon as they're able to.
Well, absolutely. Everyone should go out and get vaccinated the moment they get a chance. Thank you so much, Dr. Jha, for speaking with us today. The big message coming out of there is that we need to completely push back on COVID-19. Vaccination is the only way out. We need to start vaccinating as many people as possible, as soon as possible. Thank you once again for speaking with us.
Thank you.